Administering oral medications. Oral medication administration is the process by which drugs are delivered by mouth through the alimentary tract. Purpose: drugs are taken by this route because of convenience, absorption of the drug, ease of use, and cost containment. It is therefore the most common method used. And for the special considerations for the infants, a syringe or dropper provides the best control for administering drugs. Then place small amounts of liquid along the side of the infant's mouth, and have the infant suck the medication through a nipple. And for the children, whenever possible, give child a choice between the use of a spoon, dropper, or syringe. Then dilute the oral medication with a small amount of water if indicated. Then crush medications that are not supplied in liquid form and mix them in honey, flavored syrup, jam, or a fruit pure. Then place the toddler on your lap in a sitting position. To prevent nausea, pour a carbonated beverage over finely crushed ice and give it before or immediately after the medications is administered. Then follow medication with a drink of water, juice, a soft drink, a popsicle, or a frozen juice bar. Then, for children who take sweetened medications on a long-term basis, follow the medication administration with oral hygiene. And for the elders, usually require smaller dosages of drugs, especially sedatives and other CNS depressants. And for the equipment needed, number 1, medication tray, disposable medication cup, small paper or plastic cups for tablets and capsules, waxed or plastic calibrated medication cups for liquids, straws to administer drugs that may discolor the teeth, then drinking glass and water or juice, then pill crushing device optional, and the medication chart record. For the procedure, first is to perform the drug study because it allows you to anticipate the effects of the drug and observe the patient's response. Next is to check the MAR or the medication administration records for the drug name, dosage, frequency, route of administration, and expiration date if necessary. Check each medication card against the physician's order according to the institution's policy. If there are inconsistencies, clarify them at once. So the healthcare provider is the most reliable sources and only legal record of drugs that patient is to receive. Next is to determine whether the client doesn't have any difficulty in swallowing, on NPO, is nauseated or vomiting, has decreased or absent bowel sounds, or has gastric suction. So the alterations in GI function can interfere with the drug absorption, distribution, and excretions. Then check patient's medical history for any allergies. These factors influence how certain drugs act. Perform hand hygiene and observe appropriate infection control procedures. Then secure all the necessary equipment and obtain appropriate medication. Get the proper medication bottle box or packaging from the medication drawer and compare with Cardex or order. Make sure to check the expiration date. Expired medications may be inactive or harmful to patient. Then do the drug dosage calculations. For the tablets or capsules, use a disposable medicine cup for unit dose package medications. Open wrapper at patient's bedside. Do not touch tablets with your bare hands. Break only scored tablets by using a filer cutting device. If the patient has pain or difficulty swallowing the drug, crush the tablets with a pill crusher into a fine powder. Then mix the powdered drug with a small amount of food or water like soup, custard, or juice. Check with the pharmacist or drug handbook before crushing the drug. And for the liquid medication, counter-check label of liquid medication against the doctor's order or medication card. Then mix drug thoroughly before pouring. Then grasp liquid medication bottle with the label against your palm into a medicine cup or spoon. Pour drug away from the label to prevent spilled from dripping and soiling the label. and read the amount of medication on the bottom of the meniscus or the crescent-shaped upper surface of a column liquid at eye level to ensure accuracy of measurement. Use a paper towel to wipe the bottle lid before capping the bottle to prevent contamination of contents of bottle and prevents bottle cap from sticking. And when giving less than 5 ml drug, use a sterile syringe without the needle, allows more accurate measurement of all small amounts. Then place the prepared medication and medication card on the medication tray together. Then countercheck the medication label on the bottle with the medication card for the third time before returning the bottle or box to its storage place. Then transport medication carefully, keeping it in sight at all times. Identify the client by letting the conscious client say his full name and verify by looking at the client's wristband to ensure the correct patient. Then inform the client of the purpose of the drug and the expected side effects. Then take the required assessment measures such as HR and RR or BP. Take client's HR before administering digitalis medications. Then take client's BP 15 minutes before and 15 minutes after giving cardiac medications, especially antihypertensive drugs and diuretics. Then take the RR prior to administration of narcotics. Then assist the client to a sitting position or if not possible to a side-lying position. Then administer the drug in a prescribed dosage at the right time. Take the drug to the client within the time frame of 30 minutes before or after the scheduled time. Then offer water or other pertinent fluids with pills, capsules, tablets, and liquid medications to aid in swallowing. If client has difficulty in swallowing, ask the client to place the drug on the back of the tongue before taking the water to avoid choking. And if the drug has an objectionable taste, offer ice chips for client to suck beforehand or give the drug with applesauce, juice, or bread to facilitate the intake of the medicine without any objections by the patient. And if the client says that the drug you are giving is different from what the client has been receiving, do not give the drug without first checking the original order to avoid medical errors. Then stay with the client until all medications have been swallowed. Then ensures that patients receive ordered dose. Then dispose all supplies appropriately. Replenish stocks for next dose, then document each drug given on medication chart and record the dose time and affix your signature. Return to the client when the drug is expected to take usually 30 minutes. Report significant deviations from normal to physicians.